Please welcome back to the stage, Lori Stewart.
Good morning. You know, I just love how hard it is to quiet you down because it tells me that those connections we were talking about yesterday and kickstarting this event are really working. So what a great amount of energy there is in the room. Might be that let's get it started music too, you think? Well, I don't quite know how we can top last night. What a wonderful, wonderful, inspiring evening. Congratulations again to all of those honored and all of those of you in the room who recognized our heroes and our warriors. So this morning, we are starting another great day, not only with this dynamic session this morning, but some tremendous breakout opportunities. So stay tuned for a lot of fun. As a reminder, you can check your app to see what breakout session you registered for and the room locations. And then there'll be more opportunities for you to visit the Live Yes Experience exhibit area this morning as well. But before we get started, if you remember, I talked about those passports and filling them out. We're going to award 2 door prizes, so I'm going to draw 2 this morning, and there'll be 2 more at lunchtime. And my lovely assistant, Jennifer, if you make a lot of noise and wave your arms, will run the prize to you. So here we go. Okay. All right, the first winner is Bree Fredrickson. Oh, and let's go for number 2. Bree, maybe, I see you waving your arms, Bree. Okay, look at all these stars on this one. And Michelle Aldad, A-L-D-A-D. All right, here and here. Awesome, thank you. Congratulations. All right. Right now, we're here to learn a bit more about the topics that are particularly relevant to the arthritis community. This is our Hot Topics session. Cindy McDaniel, our Senior Vice President of Consumer Health and Impact, will host our panel of experts this morning on the mind-body connection. I can't wait to learn more about this. Please join me in welcoming Cindy and her panel. Cindy, take it away.
Good morning. I'm going to take a second before we jump into today's program for a 15-second PSA. If you've ever dreamed of being a magazine model, being on the cover of a magazine, today's your chance. Out in the experience area, we've got a white screen, you'll see it, and our Arthritis Today, very talented artistic team are here. Just get your picture made and you indeed will be the cover star of Arthritis Today. Okay. I just first want to take a second also to reflect back on last night. I thought it was such a powerful evening. And yes, every year I kind of think, how can we top it? How can this get better? But I think I want to particularly just tell Kevin how proud I am, how happy I am about the Harding Award going in that direction, because no matter who we are in this room, you know, if a lot of us are patients, warriors, volunteers, even staff. His story really tells the power of one person, the impact one person can have on the lives of many. So thank you, Kevin, for who you are, and I think we just all really want to celebrate again that great night. Okay, but here we are, morning after, right? It's great having the first session on Saturday morning after the big party. I'm actually very impressed. This room is this full because I was impressed when I got up as early as I did. But this is, I hope that at the end of, I have a couple of goals for what we're going to do today, and I hope that at the end of the time you say that was worth it. That was definitely a good use of my first hour of the day, and a good reason to get up early and get going. So 2 goals. The first thing we're going to do is build on what we started yesterday. Yesterday's opening session did a great job of laying out the progress so far in building the Live Yes Network. We revisited the promise and the domains we're impacting and all of that. And we heard some fabulous success stories from Helen and Lisa and Courtney. And then we went off to our trainings and I think learned an array of different, whether we were learning more skills as a volunteer to bring the network to life or learning how to actually live better as an arthritis warrior. Had a lot of learnings in the day. And I think today we have the chance to pick up and build on that in a very meaningful way, no matter what your role is in the network. I also think this should be a treat for us personally. You know, you are here first thing on a Saturday morning, and this is an opportunity for you all to get some personal enrichment, inspiration. We've got some fabulous speakers that have a lot to share with us. So for today, I'm your facilitator. Be a participant, relax, and enjoy this session. I think you'll definitely enjoy it. All right, let's take a quick look back at the 3 domains. We've talked about these a number of times, and you remember what we're trying to do is impact people's lives positively in the physical health domain. That's going to involve pain interference in their life, their physical functioning, fatigue, sleep, aspects like that. And that's pretty kind of a no-brainer in arthritis. Of course, you would expect that's what we would be focusing on. But, you know, we've also, as I think you all know, put a lot of focus on the social and emotional health domain. And this is where we're going to talk about anxiety, depression, ability to deliver, to perform social roles, social connectedness, things like that. And then the 3rd domain is experience of care. And this is where we really get into the medical system and how empowered we are as patients and how open our doctors are in delivering the kind of quality care that can really have an impact. Okay, so there's a lot of ways we can impact these domains. I mean, clearly we've got a whole binder of lesson plans that our facilitators can use to impact these domains. But the topic today is hot topics, so we wanted to pick out a few that are very popular today, that are in the media, people are seeing, hearing, and talking about them, and that can have impacts across domains, can really help make a difference in more than one of these. So in particular, we're going to focus today on the mind-body connection with a discussion of physical activity writ large and mindfulness. And we'll dive into what we mean by both of those here in a minute. But there's a lot of evidence that both physical activity and mindfulness can have really positive impacts on the domains we're trying to impact. So in physical activity, I don't have to convince anybody in this room that physical activity has a lot of benefits. It's very well documented, especially in the health domains. You may or may not know that it's proven to help with sleep, energy, physical functioning, mobility, that kind of thing, but also in the emotional and psychological side. You know, being physically active does a lot to build your confidence, your overall well-being, your social interaction, things like that. So a couple of things that I don't think are as well known, some specific things. Certainly, physical activity is really important for the comorbidities. We all know that if you have RA and a number of other forms of arthritis, your risk of heart disease is much higher. But being physically active lowers it dramatically. So that's a pretty well-known benefit. You might less know that in a recent study, in fact, it was just this year, published in the British Medical Journal, they found that for people with RA, physical activity has the most evidence to reduce fatigue. To reduce fatigue. May seem a little counterintuitive, but to reduce fatigue. And certainly for pain, all of the major medical societies, it seems, American College of Rheumatology, orthopedic surgeons, when they do their guidelines, physical activity is the #1 most recommended non-pharmacological approach to managing hip and knee pain. There's a lot of evidence, so I hope we all know that. Now, mindfulness, maybe not as much. Maybe you don't know as much. Maybe you don't even know what we're talking about when we say mindfulness, so we'll come around to that. But there is a growing body of data that also backs up the benefits of living mindfully on your health. And as you can see up here again, it's both the kind of psychological benefits and some physical ones that really do have an impact. The studies aren't all new. Really, there have been studies at Harvard for at least the last 20 years that have been published and kind of groundbreaking and in launching a whole new study. over the years, the studies have gradually grown and exploded in the last few years. You can look at a graph and see it just spike up at the number of studies being done on mindfulness. And they're being done at reputable institutions. NIH is doing studies, things like that. One study done in 2017 at Tufts in Boston really weaves together the impact of the mental and physical aspects. They did a study of people with OA and physical activity, Tai Chi and physical therapy in particular. And those with high mindfulness, measured through their criteria, had a much better improvement in pain and functioning. So there's some science behind this. The thing is, if you could think about these benefits, and I know some of our pharmaceutical friends are here, and we so appreciate all their work to help improve our lives. If someone came up with a drug that did everything on these slides, not only would we beat a path to get the drug, we'd probably all invest in it, because it would surely be a blockbuster, right? But physical activity and mindfulness are accessible to everybody, they're free, and yet we don't do it that much. So let's dive into why that is a little bit. So I'm joined this morning by a powerhouse panel here on the two topics we're going to be talking about. I'm going to do a quick introduction, and then I'm going to ask some questions, obviously, along the way. But at your tables, you guys have cards. And as we're talking, if you think of questions, something you would like to ask one of my guests up here, just write your card down. And at any point, you can hold it up. We've got a couple of folks who'll be watching and collecting those, and we'll leave some time at the end to answer your questions as well. Okay. To my immediate left is Jason Reiss. Jason is a physical therapist. He has a master's in PT from Emory here in Atlanta and a doctorate from Marymount University in Washington, D.C. He's practiced in Atlanta since 2000, specializing in orthopedic and sports medicine, including OA, degenerative spinal conditions, and some of those things that are very relevant. Jason has advanced training and certification in some of the newer, at least to me, aspects of physical therapy like dry needling, therapeutic taping, neurodynamics. So he is on the cutting edge of some of that stuff. He's an adjunct professor at Georgia State University, very near here, in Mercer, in their orthopedic residency program. And Jason is a member of the American Physical Therapy Association. In fact, he was recommended to us by APTA as part of an emerging, growing partnership we're trying to put in place there. So that was we were very happy that they made that recommendation for us. Jason lives with his wife, Amy, and 4 children from the ages of 4 to 14. So he's running a big practice in Atlanta. He's got the 4 children, and he's walking the talk of physical activity, very involved in his kids' sports. He enjoys mountain biking, swimming, hiking, and volunteering. So he's clearly a busy guy. Okay, also with me is Meryl Arnett. Meryl is a yoga instructor and meditation instructor with over 10,000 hours of experience teaching yoga and meditation to Fortune 500 companies and many others. She's taught from the floor of Phillips Arena across the street here, the big arena, to festivals and studios all across the city. She helped create the first yoga and meditation studio in Atlanta and is currently the co-owner of Sacred Chill West. Doesn't that sound awesome? There's just a lot of times I want to go get that Sacred Chill. Meryl's passion is introducing mindfulness in both movement and stillness in ways that are accessible to all of us. She's the creator of the Mindful Minute podcast, and her meditation classes have been featured on CNN Headline News, and in local media here in Atlanta. For those of you who dabble at least in areas like mindfulness and meditation, you'll be as impressed as I was that she has and sometimes still does study with some of the biggest names like Tara Brach, Jack Kornfield, people like that. She's a mom to 2 kids and the wife of her high school honey, and she is a UGA grad, Georgia grad. She loves to spend time in the mountains, camping, hiking, and roasting marshmallows. So join me in welcoming Jason and Meryl.
Thank you.
Okay, I thought the first thing we should probably do is a little bit of a level set. You know, these are terms physical activity and mindfulness, it could even be off-putting to people. If what you think about is doing 100 squats and lunges and twisting yourself into a pretzel shape, it may not sound like exactly what you want to do. So can we just start with level setting? Jason, tell us what we're going to talk about today in the realm of physical activity.
Sure.
And any myths we might want to get past.
Yeah, sure. Thank you for the introduction. I'm very happy to be here. It's an honor for me to be here with you guys this morning. And I'm really excited about the partnership between the Arthritis Foundation and the American Physical Therapy Association. I think that's a really good thing for all of us, so thank you very much. I think, to set the stage for this morning's conversation, and we talk about physical activity or exercise, one of the biggest things that I hear as a myth of physical activity and exercise is that exercise is going to hurt me. Exercise is going to make me worse, or it's going to inflame my condition. And I think that's partially a definition problem. Mm-hmm. And people think of physical activity and exercise as running 3 miles or swimming 20 laps or playing a high-level sport, and that's really not the case. Physical activity and exercise can be anything outside of just being completely sedentary. So it really depends on what level you're at and where you are with your physical activity. It could just be walking to the mailbox to get your mail rather than sitting on the couch, or taking the stairs instead of the elevator. Little activities like that, just to get your body moving and get your heart rate up a little bit, can be very beneficial for an individual rather than being completely sedentary and moving as little as possible. And there's a lot of benefits, and you've hit on some of those already, to physical activity, and we're going to dive into that a little bit more. And try to make it specific for the arthritis population.
And I appreciate you mentioning the little bit of movement matters. I saw a study recently that some of the greatest benefits occur when you go from being completely sedentary, just moving a bit.
Yes.
So that's encouraging.
Yeah, it doesn't take much, everybody looks to the kind of the baseline recommendation of 150 minutes of exercise, right? Mm-hmm. Which breaks down to 30 minutes, 5 days a week. And that is a great goal to shoot for, but it doesn't necessarily have to be that intense to get the benefits of physical activity and exercise.
Thank you.
Yeah.
Okay, Meryl, let's do the same thing for mindfulness. What are we talking about here today? How do we level set on that topic?
Yeah, I think that mindfulness tends to have the connotation like I'm gonna sit in lotus pose with my fingers like this, and I'm not gonna think for 10 to 20 minutes. And really what we're talking about is simply the act of learning how to be in the present moment without judgment and with compassion. And that gift, that skill, is allowing us to tap into what our habits are, the habitual ways that we think and move through the world, and instead gives us the power of choice. It gives us a little bit of freedom. Yeah.
Excellent. So for both of you, I want to dive a little bit into the specific aspects of these habits, we'll call them as a simple word, for arthritis, but in particular when we're talking about chronic pain. Now clearly, these are things that have benefits for anybody regardless, but my first thing might be, if I think about even mindfulness, if I've got my hips and knees, or it's going to be hard for me to certainly get in any kind of position and maybe even sit still for a length of time. How can people work around that a little bit?
I think the important thing to know is that you can meditate in any position. So certainly the traditional would be cross-legged on the ground, but I work with clients all the time who sit in chairs, feet flat on the ground, hands on your lap. That's perfect. If you're having a particularly tough day and you end up meditating in a bed, that works too, right? Finding ways to support your body and inviting in a little bit of stillness is the only goal. And it might be that some days 5 minutes is enough. A great goal is 10 minutes, and if you do 20 minutes, you're a meditation pro. And that's the truth.
So what about let's stay with mindfulness for a minute. What about some specific benefits you've seen, or you can talk about around a lot of the things we deal with in the chronic disease world, which are anxiety, certainly pain, things like that. What can you tell us about those areas?
Yeah, the benefits of mindfulness that I've seen in my own life and with clients really tends to be the gift of awareness. So what we really call it in the mindfulness community is the double arrow. So the first arrow tends to be whatever the thing is that sets you off. So you're waking up today with more pain than you expected, or you got out on the highway and traffic was way more intense than you planned, or your kid did the thing that pushes you over the edge. So that's the first arrow. Now I'm feeling anxiety, stress, frustration. And then the second arrow is all the things I tell myself about that. So I woke up with more pain than I expected, and now I know I'm not going to be able to do these things that I planned, and I'm letting so-and-so down, and now I'm feeling this way about myself. It adds to our stress, it adds to our anxiety, it adds to our depression. And so mindfulness allows us to let go of that second arrow. You're not going to suddenly not encounter stress in your life, but you do have the choice of how you react in it. One of my favorite studies around stress asked 2 questions. And the first question was, do you think you experience high levels of stress? And we can all probably say yes to that. And then the second question was, do you think stress is bad for you? And what the study found was those who said, yes, I experience high levels of stress, and yeah, I think it's bad for me, they struggled more. They had more instances of illness, of depression, of high anxiety than people who said, yes, I experience a lot of stress, and no, I don't think it's bad for me. So it's giving us the gift of shifting how we respond to the difficulties in our life.
Excellent. Thank you. So Jason, same thing, physical activity. We talked about the fact that people think it's going to hurt, and that keeps them from doing it. But what have we seen in maybe how it goes the other way and helps with helping people move better, feel better, possibly reduce pain? Anything that you can talk about in that arena?
Yeah, sure. I mean, I think the benefits of physical activity have to be related to each individual's goal. So if you take 2 different ends of the spectrum, you might have somebody who is pretty high level and high functioning, yet they suffer from, let's say, low back pain because of an arthritic condition. Their goal might be that they want to play tennis with less pain, or they might want to play golf with less pain. And you can take that person and watch them move, for instance. This is what a physical therapist might do. Watch them move and determine that they have some range of motion limitations or some movement limitations that we can help them with, teach them the right type of exercises and movements to do to address those limitations so that they can then meet that goal of playing golf or playing tennis at a higher level with less pain. So it's really individualizing that movement to that individual to meet their goals, but it's all goal-driven. You might take the other end of that spectrum and somebody who's had multiple back surgeries and they're having difficulty with just normal daily activities. They need help getting out of bed, or they need help dressing, or they need help with bathroom activities, whatever the case may be. And then their goals are much different. But our job as therapists would be to look at that person in a very similar way and figure out what their limitations are, what movement limitations they have, where are they stiff, where are they weak, and develop a physical activity or an exercise program that's specific for them to help them meet that goal.
Perfect.
Yeah.
So you started talking a little bit about people who really just need to get moving at all. What advice can you give us? So if some of us are not as active as we want to be or not active at all, what's a good, safe way to get started and build a habit around physical activity?
I think avoiding pain would be a good one. Or let me rephrase that. I'd say minimizing your pain. Not all pain is bad, and I think being mindful of that is important, and realizing that sometimes you can have discomfort, and it's okay to have that discomfort, and being able to realize that and being able to make that judgment call of what's too much, what's not enough. But starting at a realistic point is important, and finding out Where that point is for you individually, I think is key, and not overdoing it in the beginning. Just start slow, gradually build yourself up. And some of that's based on just what your history looks like, how active have you been in the past, and some of that is based on what your goals are. What are you shooting for? Mm-hmm. So just start slow. If it's completely new to you and you really don't know where to start, find somebody to help you. Find somebody that knows about your condition. Find somebody that knows a little bit about the science of exercise and that can help you put a program together that's individualized for you and has less of a chance of irritating the condition.
Okay, thank you.
Sure.
So same thing, Meryl. People are hearing all this buzz about mindfulness and a little interested in getting started. How can we do that?
You know, I think the easiest way these days is to use an app, and there are so many good ones out there. My personal favorites are, there's an app called Calm, and there's an app called Headspace, both of which do a phenomenal job of just a 10-minute guided meditation. So it's going to talk you through what you're doing and what you're not doing, and you can let go of this idea of I can't think, right? You don't have to worry about it, you can think. So it'll talk you through, it gives you a fresh one every day, it'll keep you sort of inspired. And then I'll say the same thing, if you're really building a practice, the best way to support it is find a community to meditate with. And there are in every city now mindfulness communities, so that's what you'd search for, is mindfulness.
So that's an interesting question. You know, I do know that both physical activity and mindfulness are things you can do completely by yourself. Don't need a lot of equipment, just some shoes, maybe, you know, a smartphone, and we're off and running. What are some benefits of joining a group? I mean, let's talk a little bit about just validating. I think there are benefits of doing this right by yourself. You don't have to do anything special. But what are some benefits of joining a group or getting some professional assistance in the form of physical therapy, for example? So, Meryl, you just mentioned that. What would you say are the benefits? And you say they're widely available, but I'm not sure that I would quite know where to go. So help us with that a little bit.
Sure. So benefits first. You know, one of the things that's going to happen if you start a meditation practice is you're going to be really excited. You love today's talk. You download the app, and first day goes great. Second day is pretty good. Third day, you're about 3 minutes in, and you're like, I got to go to Target. And you get up, and you're out the door before that timer even rings, right? And then 6 months later, you think, oh, I was going to start meditating. So the community will help hold you accountable, right? You say, once a week, I'm going to go meditate with a group. It's going to help me stay accountable to myself. And it's going to help me answer questions like, this is boring, is that normal? Or I'm having a lot of anxiety today, I meditated and it felt worse. Is that normal? Yes, right? So you'll have teachers and other practitioners to help validate your experience. It's really easy to feel like, I set a timer for 10 minutes, I wrote a grocery list in my head, it doesn't count. But it's meditating. If your intention was, I'm going to sit for 10 minutes today and be mindful, be present, it doesn't matter if you also wrote a grocery list in your head. It still counts as part of the meditation practice. And if you're looking for a group, so there's all different types of meditation, just like there's all different types of physical activity. So mindfulness meditation is going to give you a non-religious, non-spiritual experience of meditation. There are Buddhist meditation centers, there are lots of different lineages, but mindfulness meditation, in Atlanta, if you search it, you'll get the Atlanta Mindfulness Institute, you'll get my studio. So whatever city you're in, I would start by searching mindfulness meditation Chicago or whatever, and see what comes up. That's where I'd look.
Good. And I'm just curious, what might I expect to pay for studying with a class or with an instructor in meditation? Is there a standard set of cost or not?
Somewhere between $15 and $25 would be my guess. In Atlanta, that's pretty much standard.
Okay. Good. All right, so Jason, now I know that there are a lot of people out there promoting themselves as helpful with physical activity, and there's some really good ones, whether it's, gyms, trainers, but I'd love your thoughts on those kind of options, and then also help us understand what a physical therapist can do to help us with getting active and staying active.
Yeah, sure. There are a lot of options for physical activity. I mean, there's a gym on every corner. There's a PT in your neighborhood, I'm quite sure. And it really, I think the benefits first of finding a professional would be to help somebody keep you accountable, as well as to guide your exercise program to make it individualized for you. I think that the group setting is good because it adds a social dynamic to it. So I'm a social person. If I'm going to go out and exercise or go out and get some activity, I would rather do it in a group. I would rather do it with a friend. I'd rather do it with my spouse or whatever the case might be, because that social interaction or that social interplay as I'm doing it helps keep me motivated to do it more, right? Because it's enjoyable.
Yep.
On the flip side of that, if you're an introvert and you would rather be by yourself or you enjoy that alone time, that's totally fine as well. I mean, I think to get you going with that type of thing, maybe you listen to a podcast or maybe you listen to the radio while you're doing it. Just make it enjoyable, and that'll get you in tune with what you're doing. But physical therapists, we're uniquely positioned because we have a lot of knowledge of disease processes, and we have a lot of knowledge of human movement. Really, we're movement specialists. So a PT can really analyze your movement, figure it out based on what your goals are, break that down into small components, and give you some guidance on how do you work on each small component to meet your overall functional goal.
Okay.
Whatever that might be.
Now, I know that I can walk into any gym and pay the membership fee and we're good to go. How do I see a physical therapist? Can I self-refer, or do I need a doctor's referral, and how does that work?
That is state specific.
Okay.
And so most states now have some form of what we call direct access. And direct access means you can walk directly into a physical therapy outfit and tell them that you want to see a therapist, and sit down with a therapist and do what we call an evaluation, where they talk about your goals and why you're there, and then set up a program for you. That's available almost nationwide. There's still some states, I believe, that don't have that. The traditional way to see a therapist is you see your doctor and you have a pain complaint or a movement complaint or a functional complaint, and your doctor refers you to therapy. And that's certainly the majority of our patients, but more and more now we're getting people coming directly to us based on word of mouth. Maybe their neighbor saw a therapist and they sent them to us, and it's more that direct access referral path. But that is state specific, and what I would recommend is if you're interested in physical therapy, call a therapist where you live and just ask them. They should be well versed on what the legalities of that are.
And then I think that the number of visits that would be covered, is that determined by the insurance company in particular, or is there some regulation around that as well?
That's insurance specific,
Okay.
yeah. So whether you're Medicare or have private insurance, each insurance contract typically has some limitation on the number of times you can see a therapist. And there are a lot of therapists now that are cash-based, and they've moved out of the insurance realm, so you can go and see a therapist and pay them like you would a trainer or a massage therapist or somebody of that nature, and then you're not restricted, I'll say, by the insurance companies.
Okay. All right, I've got one more question, and then I want to see if we're getting some questions from the audience and give you a chance to answer those. That's sort of the model in our Connect groups, is that we have the ability to have subject matter experts come in and share information, but also to really interact directly with the people in the groups and answer questions and provide that more personalized support. So in cases of extreme need, so let's just say, for example, Meryl, someone has gone through a trauma or a grief, a death in the family, a time of extreme, I guess, psychological need, if you will. How does meditation play a role there?
That's a really, it's an interesting time, right? So often we feel in a moment of extreme trauma or extreme stress, I'm going to meditate because it's really going to help me. And I would really say, if you haven't meditated before, that's not the moment to start. There are many other forms of self-care that would be tremendously beneficial in that moment. If you've never meditated before and you're in a moment of very intense emotion, the thing that's going to happen when you sit down, close your eyes, and get still is you're going to feel all of that emotion. The gift of a daily meditation practice is it's building your capacity to feel emotion. So then, when something really intense happens, a death in the family, a trauma of some sort, you're prepared to feel that, right? So one of the things that I often discuss with clients is how meditation is often a practice of learning how to be uncomfortable. That's what it is. You're learning how to be comfortable with discomfort. And that's not just physical discomfort, but it's emotional discomfort. It's mental discomfort, right? We sit down to close our eyes for 10 minutes and we're feeling lonely. We're going to still feel lonely in that 10 minutes. It's not like the timer rings and you suddenly feel happy and peaceful and connected. Maybe not in that moment. But you might learn that you can be lonely and take another breath. I can be stressed and take another breath and get through this moment. And we see over time that every single feeling, every emotion, every physical sensation, it changes. Nothing stays forever. So we're learning how to sort of ride those waves of intensity.
Wow, that sounds really powerful if you can build it and be at that point. Wow. All right, so Jason,
Yes.
in physical therapy, I know people often think of it as something you do post-surgery, and so it might be interesting to talk a little bit about that. It's an important part of post-op rehab. But I also want to see if you can comment on people who maybe have a crisis in their physical experience, in their physical movement. They suddenly, have a major flare or a major new joint involvement and they can't move well at all. What can you offer in those two situations?
So I think in both of those situations, the fear that someone experiences is, I'm going to lose function. I'm going to lose the ability to do things that I love. I'm going to use the ability to go out and interact socially or whatever the case may be. And in the post-op situation, we start with physical therapy. We start kind of in a very local sense. Let's say you've had a knee replacement. We'd start looking at the knee itself and decreased swelling, decreased their pain, and then improving their range of motion, improving strength around that particular joint. But then we take that and we grow it to the hip and to the foot and ankle, and we look at range of motion there and how do those two joints, those two adjacent joints affect the movement and function of the knee. And then we start to move more globally and look at the whole body and how does it all interact. But it's all goal-driven to get somebody back to the activities that they want to get back to. So the same would come into play with a trauma, so somebody or an inflammation flare-up. We have to break that down to its components and figure out what we can do at the area that's inflamed and irritated first to get that to calm down, and then how can we expand that treatment to the entire body to get them back to function. And developing a good physical activity, range of motion program, exercise program that helps meet those individual goals as we move along.
Excellent. Well, it's clear these are both cumulative practices that build as we do them consistently. So, do we have some questions? Thank you. Okay. So, Jason, as a physical therapist, what type of movement would you suggest for morning stiffness in the lower limbs and extremities, like ankles, for example?
People that tend to wake up very stiff and immobile, it's because you've been laying down and you haven't moved for a period of time. So your joints will tend to stiffen up. If you have inflammation within those joints, that stiffness will tend to be more severe when you first wake up. What I typically recommend is don't jump out of bed and expect to go into a stretching program right off the bat. Get out of bed, brush your teeth, do your normal morning routine, get some blood flow to those joints first, and then move into a stretching program. But really, light, rhythmic stretches, something that's not aggressive, is the best way to start to get a joint to loosen up. There's a lot of different specific stretches for individual joints, but I think that'd be my general statement.
Okay.
Move around first, get some blood flow, warm that joint up, and then go into some specific light stretches in the morning just to get it moving.
Okay.
Yeah.
All right. So Meryl, we've been talking a lot about mindfulness, but always in the context of adults in the session here. We do have, of course, a lot of parents in the audience, including parents whose children could be the one with arthritis. Regardless of that, do you have any advice for introducing mindfulness to children? The particular question was for a 7-year-old, but you might even have an age that you think is best for it. And specifically also something that can help them get settled for bed. Any thoughts on that?
Yeah, I have 2 children myself. And so the general rule of thumb is if you're going to introduce mindfulness with children, you're going to work the same number of minutes as they are in age. So for a 7-year-old, no more than 7 minutes. And I probably wouldn't even start there. 3 minutes. And starting with something really simple like a body scan. So just having your child sit or lie and not expecting them to be still the whole time, but ask them, can you scrunch your forehead up and then relax it? Can you scrunch your lips up and then relax them? Can you bunch up your shoulders and relax them? Can you make a fist and relax it? And help them work their way down their body. It's such a nice way to introduce children to paying attention to their body, to their physicality in space, and hopefully inviting in little moments of stillness in there.
Yeah. Thank you. So Jason, we've got several questions here about dry needling. Yes. And some of the other more innovative things that might be useful. One person who's asking particularly about osteoarthritis, which doesn't have the array of treatments, doesn't have any treatments really much. So what do we have in physical therapy that can help people in pain feel better?
We have a lot of things, right? So if you have a joint that's arthritic, let's just take the knee as an example, and that arthritic knee joint is stiff. The joint itself is swollen, which is going to decrease your mobility. But secondary to that, that joint swelling and joint stiffness is going to transfer to the muscle tissue around that joint. So that muscle is going to become stiff, and muscle is going to become filled with myofascial problems of trigger points. So dry needling is a great technique. It's a way for us to go into that muscle and release these trigger points. And trigger points, really, they're not a mysterious thing. They're just areas within a muscle that are tonically contracted. So it's like a muscle fiber that's contracted and just won't let go. And the dry needling is a way to get into that muscle tissue and get it to finally relax, which will lengthen that tissue and therefore allow more mobility at the joint. So it's secondary to what's happening at the joint, but it can relieve the joint itself.
So is it more or less what it sounds like? You just use a needle, but you're not injecting, but you're just taking a thin needle in and moving it around?
Correct, yes. There's no medication involved with it. It's an acupuncture needle, so it's a microfilament needle. We put it into the skin and into the muscle. We hit the trigger point. Typically, it creates a small contraction. It almost feels like a really short-lasting Charlie horse. You get that little contraction, and then that trigger point has gone away. You typically follow that up with some soft tissue work and some stretching to lengthen that tissue out, which is the effect that you're after to begin with. And it has pain-relieving components as well as motion components as secondary benefits to using that technique. It's a fantastic technique. It really works well. There's also ways to put needles into the surrounding muscle and use electrical stimulation to stimulate that muscle, which is a little less uncomfortable than the traditional hitting the trigger point with the needle and getting the contraction. Both work well.
You mentioned like an acupuncture needle, but this is different from acupuncture, I think. Yes. I do have a question about acupuncture here. Someone's interested in are there any studies? What do you know about it, whether or not acupuncture, and if you don't have to answer, that's okay, but acupuncture to help someone with arthritis and fatigue?
Yeah, my knowledge base is certainly not with acupuncture. I'm not trained in acupuncture and would never claim to be so. I think there's overlap with the two techniques. I think that we use the same tool, but the theory is completely different. Acupuncture Theory is releasing energy through energy pathways that they call meridians, and physical therapists use the dry needling in a completely different manner. We're looking to affect the muscle tissue by releasing trigger points. So the theories are completely different.
Okay. So what advice can either of you give from your perspectives for someone who needs to recover? Let's just say you've just, and I'm talking here, I guess it would be more physical, but I just wonder if mindfulness would have a thing as well. I know that a few people in this room are getting ready to ride 500 miles down the coast of California here in a few weeks, and that's a pretty big undertaking. So what might they do in the morning to be ready for those days, and in the evening to recover, to kind of be able to get back on the bike the next day? Any advice for them?
Nutrition, I think, is going to be important, making sure you're eating well and staying well hydrated before your ride. And that's got to be done well in advance of the morning before. I always tell people, my athletes that I'll treat, as soon as you feel like you're thirsty, you're already dehydrated. So staying ahead of that 8 ball is going to be very beneficial for your tissues and for your general body system to get you through a long athletic event like that. Recovery, I think the important thing with recovery is stretching, good flexibility, some relaxation techniques to kind of settle down and cool off and get your body to a restful state so you can get a good night's sleep and be ready to hit the road again the next morning.
So no particular stretches that would come to mind. I guess it sort of depends on what's impacted.
Yeah, but I think, after something like that, you're going to focus a lot on your lower body because you've been pedaling so hard for a period of time, and just trying to relax the quadriceps and hamstrings and calves and glutes and hips through some light stretching techniques would be a good idea to recover.
And so, Meryl, besides being mindful enough to really take in the most beautiful scenery in the country, any other tips from the mindfulness perspective for someone taking on an adventure like that?
Yeah, a lot of athletes use mindfulness as well, and it really comes more from an intention setting capacity. So this idea that you're embarking on an adventure like a 500-mile bike ride for a really specific reason. Nobody wakes up and says, this is what I'm going to do today, right? And so creating the space and the ritual around knowing what my intention is and then checking in with it on a daily basis before you embark on whatever your next mileage is just helps to hold us strong for the days that are more challenging or something unexpected happens, you're more fatigued. It's having that anchor. This is why I'm doing it. So 10 minutes in the morning before you get on that bike is amazing.
Excellent.
Yeah.
All right, I've got one more question, and we've got a few more minutes. So if there are any more questions in the audience, hold your cards up. We can take another one or two maybe. So, Jason, someone's asking here about physical therapy training specifically for arthritis. I don't know if there is much right now, and the question is, should there be? Should we do more to have physical therapists? And maybe I'm wrong, maybe there is. What is currently in a typical PT program? What kind of training do PTs get for working with patients with arthritis, and what might we want to see more of?
Like any graduate level program, when you go into physical therapy school, the analogy I like to give is it's kind of like drinking from a fire hose. You're loaded with so much information at one time, and you have to be able to come out of school ready to treat pediatrics all the way through the lifespan to the elderly population. So you are loaded with so much information that it's overload, right? Not in a bad way, and you do learn a lot about each specific thing, but it's hard to take it all in and make it useful. Once you get out of school, there's so many different avenues that you can take with a physical therapy education to specialize in a certain area. So my field of specialization has always been orthopedics. That's what I was interested in, sports medicine and orthopedics. So you can take that and go into a residency program and learn more and more about it. The American Physical Therapy Association has also different sections that you can become involved in, and each section has its own educational series of courses that you can take. So we do have one on arthritis, so a therapist can go and become more specialized in that field and more educated in that field so that they're better suited to treat that particular type of patient when they come out. So physical therapy can become very, very, very specialized like anything else, or it can stay relatively general so you can treat a wide array of patients that walk through the door, people that need your help.
Okay, good. And I know, Meryl, as the field of mindfulness and different kinds of training and all grow, are you seeing growth in any specializations there for helping people deal with, for example, chronic pain or chronic anxiety or things like that?
I don't know that there's meditation specific to chronic pain, for example. It tends to be more whether you're going to go the mindfulness-based route or a Buddhist lineage of meditation. And the truth is they're very similar. It's just that mindfulness doesn't talk about Buddhism. The idea behind it, being present without judgment and with compassion, is the same across the board. And the ultimate goal is the same across the board. It's giving us freedom in our daily life, period.
Okay.
Yeah.
Thank you. So, kind of following up on that question, it seems, someone says, that the physical trainers you would encounter in a gym or somewhere, Jason, really might not know much about arthritis and could even give you harmful advice. Do you have any recommendations? And this is a little bit putting you on the spot, but do you recommend working with a trainer you might encounter down at LA Fitness? Or how do you find a trainer, if that's the route you want to go, that would have the right skill sets?
I think that trainers can be highly qualified individuals, and I don't have anything negative that I would say about them. They have different levels of education that they can go through as well to suit them to treat more medically complex individuals. I think if you are a medically complicated individual, you're probably better off seeing a physical therapist because they do have further education in disease processes and how that might respond to exercise. But that's not to say that you can't find a trainer who's well versed in that as well. So that's a tough one. I mean, it's finding the right individual. So walking into a gym and being able to select that right individual might be tough. So it might be a word of mouth thing where you start to ask people in your community, who have you used, who have you had good success with, and trying to find some recommendations that way, or maybe your physician would have some access to that information because they may have used people in the past. For physical therapists specifically, you can go on American Physical Therapy Association's website, and they have a link on there called Find a PT. Mm-hmm. You can click on that link and look for a specific area of need that you might have, and it'll direct you to physical therapists in your local community who have more education in that field or that area of expertise that you're looking for. Trainers may have the same type of thing. I'm not sure, depending on what certification they have, that some resource might be out there for them as well. But I think word of mouth is always good, and it's always good to look in your community for some recommendations of who might work for you.
Okay, we have just a few more minutes, and I've got just a couple more things that I think are you'll find this audience has a lot of interest in, especially in the physical therapy realm, ways to find new approaches. So,
Sure.
Question here about K-tape.
Yeah.
Which might be the therapeutic taping you were talking about.
Yes.
What's your opinion on that as a way to lessen stress on joints during an active flare?
So kinesio tape is a brand of tape that physical therapists use. There's a lot of other brands that do the same thing, and the tape is used to, one, decrease inflammation, two, take some stress off of a muscle if you use it in one way, or you can use it to actually facilitate a muscle to contract better. So it depends on what goal you're after with that. I think kinesio tape can be very beneficial. Me personally, I'll use kinesio tape after I do a technique like dry needling because I've loosened that muscle up, I've gotten rid of the trigger points, I've lengthened the tissue, and now I want to put a product on that muscle to try to help it stay relaxed. So I can use it in that realm so that it doesn't tighten right back up. If a muscle is weak and a muscle needs to be strengthened and somebody's having a difficult time getting that muscle to contract, I might use it in the other realm and try to use it to facilitate some muscle contraction. So it can be helpful. It works very well for some people. The other benefit of kinesiotape is you can teach the client how to put it on themselves so they can use it outside of coming to see you, so they become independent in the use of kinesiotape. And you can now buy these products on Amazon, you can buy it at sporting goods stores and things like that. So once you learn the benefits of it, and if it works well for you, then the therapist could teach you how to do it to yourself so you become independent and you use it on your own.
Excellent. So one question that merges mind and body here has to do with exercises. Yoga is an example, but there are others, I'm sure, that can be adapted. Any advice for people that really want the benefits of, let's just take yoga. Meryl, I believe you're a yoga instructor as well. I know we've even had sessions sometimes on seated yoga and such as that. This is our last question. I'm getting my signal on that. But do you have any maybe even resources for how you can adapt things like yoga to your physical capabilities?
There are many ways to adapt it. If you're thinking of going to a studio, my number one piece of advice would be to call the studio and be completely upfront about what you're feeling, what you're working with, what limitations you might feel you have, and ask what they recommend, because you'll find that with any sport, there's a wide spectrum of trainings out there. So you're going to want to find a yoga teacher that's got training in chronic pain, in accessibility, chair yoga, or restorative yoga. So if you were just to be doing a Google search, for example, I would probably search accessible yoga as the first step and see what comes up. And then I might follow that up with either chair yoga or restorative yoga would be the best bets for finding very safe movement.
And I started with a PSA. I'll close with one as well. Many of you are familiar with a tool that the Arthritis Foundation developed a few years back, actually with physical therapists, which is called Your Exercise Solution. And it's available free on arthritis.org. It's another place you can go and get adaptations for a number of exercises based on what joint is involved. So if you have a chance, check that out. I have some questions we didn't get to, so I think Jason and Meryl will be able to stick around for a little while after the session.
Yes.
And answer any specific questions you guys might have. But I'm going to turn it back over to Laurie to close out our session.
That was indeed a powerful panel. Again, a round of applause. I took some good inspiration from these folks. I'm going to keep walking to work, even though it rains a lot in Seattle. I'm going to try and keep that habit up. And then when I get to my office, I'm going to close the door and be silent. Maybe. I'll try, I promise. All right, well, we are about to move into a demo, if you would like to do that, scheduled in the exhibit area in the International Ballroom A, so that's just around the corner. This is a cane fit program. How fascinating is that? Dr. Tom Rennie from our San Antonio Local Leadership Board will demonstrate a program he developed with a martial arts partner. It's for people who may need to rely on a cane, and it helps them to think about the cane not as a symbol of weakness, but rather as a powerful tool for empowerment. I love that idea. Powerful tool. So again, you can find your breakout sessions on the app or look for one of those volunteers in a green shirt. I look forward to seeing you at noon again, and we'll have 2 more prize drawings. Thank you. Have a great morning.